Have you ever noticed that you've been taking medication for years, but you still feel tired, have pain, and lack energy? And what if I told you that the problem isn't the lack of medication, but the type of medicine you're receiving? If you've ever left a doctor's office feeling like the doctor treated the symptom, but didn't look at you as a whole person, you're not alone. Today, you're going to discover why this happens to millions of people. And more importantly, you're going to learn exactly what to do to get out of this trap and finally regain your vitality. Stay with me until the end, because I'm going to show you the 4 pillars that modern medicine ignores, and that can be the key to transforming your health for real. Let me tell you a real story that completely changed my view of medicine. A few years ago, I received a message from a follower named Maria. She was 52 years old and wrote to me in desperation. Maria was taking 4 different medications. 1 for high blood pressure, 1 for cholesterol, 1 for anxiety, and 1 for chronic back pain. For medications, for different doctors, for specialties. But you know what she told me that deeply marked me? "Doctor, I don't feel healthy. I feel like a pile of symptoms being covered up. Each doctor looks at their part, gives me a prescription, and I leave with another medication. But I still have no energy, I'm still anxious, I still feel pain. When am I going to feel really well?" And it was at that moment that it dawned on me. The system wasn't failing because of the incompetence of doctors, it was failing because it was built with a different purpose. Modern medicine was made to treat diseases, not to create health. And this difference, which seems subtle, changes everything. In the next few minutes, I'm going to show you exactly how this system works, why it can't solve chronic diseases, and most importantly, how you can take control of your health using a different approach, the integrative approach, which doctors like Dr. Mark Hyman, Dr. Andrew Weil, and many others defend. So if you're tired of treating symptoms and want to understand the causes, this video is for you. The first thing you need to understand is how modern medicine was built. And to do that, I need to explain what the biomedical model is. The biomedical model emerged in the early 20th century and was a revolution. It brought a simple but powerful idea: the human body works like a machine. And when a part of that machine breaks, you identify the part, give it a name, the diagnosis, and fix or replace it, the treatment. And look, this worked incredibly well. Emergency surgeries, infection treatments, trauma, appendicitis, pneumonia. In these situations, the biomedical model saves lives every day. And I would be the last person to deny it. The problem is that health challenges have changed. Today, what makes us sick the most is not acute infections or trauma. It's chronic diseases. Type 2 diabetes, hypertension, obesity, anxiety, depression, chronic fatigue, autoimmune diseases, digestive problems. And do you know the main characteristic of these diseases? They don't have a single cause. They are multifactorial. Let me give you a practical example. You have high blood pressure. The doctor measures, confirms, and prescribes a medication to lower your blood pressure. Perfect, right? The medication works. Your blood pressure normalizes. But nobody asks, why do you have high blood pressure? Is it because you've been sleeping poorly for years? Is it because you're stressed at work? Is it because your diet is rich in sodium and poor in magnesium and potassium? Is it because you're sedentary? Is it because you have chronic inflammation in your body? Probably it's a combination of several of these factors. But the biomedical model wasn't made to investigate this. It was made to name the disease and attack the symptom. And the result? You become dependent on the medication for life, because the cause is still there. Now look at the difference with the integrative approach. In integrative medicine, the doctor asks you about your sleep, your diet, your stress level, your social life, your work, your gut. Because everything is connected. Your gut, for example, produces 90% of the serotonin in your body, the hormone that regulates your mood. If you have an inflamed gut, you'll have more anxiety and depression. It's not enough to just take an antidepressant if you don't take care of your gut. Your sleep affects your hormones. Your hormones affect your weight. Your weight affects your blood pressure. Your blood pressure affects your heart. Your heart affects your energy. Everything is connected. And that's why the first rule is this. If you want to solve your chronic diseases, you need to stop treating just the symptom and start investigating the root cause. But now you must be wondering, but wait, if this is so obvious, why do most doctors keep treating just the symptom? Is it because they don't know this? Is it because of bad will? Is it because of the greed of the pharmaceutical industry? The answer will surprise you. Because the problem isn't with the doctors. And it's not a conspiracy theory. The problem is with the structure of the system. And that leads me to the second point. The second thing you need to understand is that doctors are trapped in a system that doesn't allow them to do the job they would like to do. And when I say this, it's not just an opinion. It's based on real data. A consultation in the public health system lasts on average 7 minutes. 7 minutes. In private health plans, the average is 10, at most 15 minutes. Now think with me. In 10 minutes, the doctor needs to greet you, hear your main complaint, ask questions about your history, perform a physical examination, order complementary tests if necessary, prescribe treatment, make notes in the electronic system, guide you on what to do. It's humanly impossible to investigate the root cause of a chronic disease in 10 minutes. And there's more. The system doesn't value prevention. It values treatment. The doctor doesn't earn more if they help you reverse your diabetes with dietary changes. But the system as a whole revolves around prescribing insulin, ordering tests, and doing follow-ups. It's not bad will. It's how the system was designed. And look, I've already talked to hundreds of doctors who told me the same thing. I would like to have time to investigate the patient's lifestyle, but if I do that, I'll attend to 3 people a day instead of 30. And then I'll lose my job. So what happens? The doctor does what they were trained to do within the system's limitations. Identifies the symptom, gives the diagnosis, prescribes the most effective medication for that symptom. Next patient. And the patient? The patient leaves with another prescription, another medication, but without understanding what's causing the problem. Now here's the good news. You don't need to wait for the system to change. You can start acting now. There are doctors who practice integrative medicine, functional medicine, preventive medicine. They are doctors who dedicate 40 minutes, 1 hour per consultation. They investigate your lifestyle. They order different tests. They look at you as a whole. These doctors exist. And more people are seeking this type of care. But beyond that, and perhaps even more important, you can start investigating the causes yourself. You can start paying attention to how you feel after eating certain foods, how your sleep affects your mood and energy, how stress impacts your body, how lack of movement makes you more rigid and painful. Because nobody knows your body better than you. The doctor has the technical knowledge, but you have the experiential knowledge. And when you combine the two, technical knowledge with self-knowledge, that's when you start building real health. The second rule is, seek professionals who listen to you, who investigate causes, who look at you as a whole, not as a list of symptoms. And at the same time, become an active observer of your own health. Now you might be thinking, okay, but in practice, what do I do? What are the causes that modern medicine most ignores? That's exactly what I'm going to show you now. And get ready, because some of these factors will surprise you. There are 4 fundamental pillars that determine whether you'll have health or disease. And the traditional biomedical model practically ignores all of them. Pillar 1, diet. Modern medicine grossly underestimates the power of food. You go to the cardiologist and they prescribe statins for cholesterol, but they don't explain that refined sugar and processed vegetable oils cause much more inflammation than natural fat. You go to the gastroenterologist with reflux, and they give you omeprazole, but they don't tell you that the problem might be the excess of refined carbohydrates that are fermenting in your stomach. Food is not just fuel. Food is information. Each bite you take sends signals to your body. Signals of inflammation or healing, signals of disease or health. Pillar 2, sleep. Chronic poor sleep is not just fatigue. It's inflammation, it's hormonal dysregulation, it's weakening of the immune system. When you sleep less than 7 hours a night regularly, your cortisol, stress hormone, becomes dysregulated. Your insulin becomes less efficient, path to diabetes. Your leptin and ghrelin, hunger hormones, become disrupted, you eat more and worse. Your immune system weakens. But how many doctors ask about your sleep? How many investigate if you have apnea, if you're on your phone until late, if your room is dark enough? Pillar 3, chronic stress. Stress is not all in your head. Stress is a real physiological response that causes inflammation, suppresses your immune system, increases your blood pressure, and dysregulates your hormones. You can eat perfectly, sleep 8 hours, but if you live in a state of chronic stress, toxic work, bad relationship, constant anxiety, your body will get sick. And what's the traditional medicine's response to stress? Anxiolytics, antidepressants, sleep medication. But what if the problem isn't chemical? What if the problem is that you need to change jobs, learn to meditate, do therapy, set boundaries with people? Pillar 4. Gut microbiome. This is the pillar that fascinates me the most. Your gut has trillions of bacteria that influence everything in your body. Your mood. 90% of serotonin comes from the gut. Your immunity. 70% of the immune system is in the gut. Your energy. Your skin. Your digestion, of course. And even your weight. When your gut is inflamed, imbalanced, you can have anxiety and depression, a chronic fatigue, autoimmune diseases, skin problems, allergies. But how many doctors investigate your microbiome? How many tell you about the importance of fiber, probiotics, fermented foods? These are the 4 pillars. And when you take care of them, diet, sleep, stress, gut, you're not treating symptoms. You're building health. Now let me ask you a sincere question. Why does this matter so much? Because health is not the absence of disease. Health is vitality. It's energy. It's waking up in the morning and feeling that your body works. Health is you looking in the mirror at 50, 60, 70 years old and not feeling old. It's having the disposition to play with your grandchildren. It's traveling without fear. It's living fully. And when you understand that your chronic diseases are not a genetic condemnation, not luck, but the result of imbalances that can be corrected, you regain power over your own life. You move from being a passive victim who waits for the next medication to being an active protagonist who builds your health every day. And look, I need to make this very clear. I'm not saying you should throw your medications away. Don't do that. Never do that without medical guidance. Medication has its place. Many times it's necessary, it saves lives, it gives you quality of life while you work on the causes. But medication alone won't give you the health you deserve. It will control the symptom, and that's important, but it won't free you from the disease. Freedom comes when you understand that health is built with daily choices. And those choices are within your reach. So, let's recap everything we've seen here, because I want you to leave this video with complete clarity. First, modern medicine works based on the biomedical model. A model that sees your body as a machine and treats isolated parts. This model is excellent for emergencies and acute diseases, but fails with chronic diseases because they are multifactorial. They require an integrated vision. Second, the system doesn't give time or incentive for doctors to investigate deeply. 10-minute consultations don't allow for lifestyle investigation, but you can seek professionals who practice integrative, functional, or preventive medicine. Doctors who dedicate time and look at you as a whole. Third, there are 4 pillars that modern medicine generally ignores, but that are fundamental. 1. Diet. Food is information, not just fuel. 2. Sleep. Poor sleep is systemic inflammation. 3. Stress. Chronic stress makes your body sick. 4. Microbiome. Your gut influences everything from immunity to mood. 4th, health is not built in the pharmacy. It's built in your plate, in your bed, in your routine, in your daily choices. If you take away just one thing from this video, let it be this: you have more power over your health than you imagine. And the more you learn, the more you free yourself from the system's dependence. If this video made sense to you, if you identified with this frustration of treating symptoms without resolving the causes, leave a like below. This helps YouTube show this content to more people who need to hear this message. And if you're not yet subscribed to the channel, subscribe now. Because every week I bring you content like this. Science-based information without sensationalism, without conspiracy theories, focused on empowering you to take control of your health. Now, I have a video that is the perfect continuation of this one. In it, I'll show you the exams you should ask your doctor to order if you want to investigate diabetes. The link is here on the final screen. Thank you very much for watching this far. This shows that you really care about your health. And I'm here to support you on this journey. See you in the next video.